Good afternoon. I'm Joe D'Amato with the Wisconsin Alumni Association. On behalf of the Wisconsin Alumni Association and Capitol Lakes Retirement Community, we're so glad you could join us for this important conversation about sleep and its effects on our health. Though we're unable to gather in person due to COVID-19, we are thrilled to bring badgers together for this virtual event. Today's program will begin with a presentation, followed by an interactive Q&A session. This is your chance to ask all your great questions, so please submit those via the YouTube chat throughout the talk. Our speaker today, Dr. Stephen Barczi, is a nationally recognized medical educator, geriatrician, and sleep specialist that is a member of the faculty at the University of Wisconsin School of Medicine and Public Health. He is clinical director for geriatric research, education, and clinical center at the William S. Middleton Memorial Veterans Hospital and the Geriatrics and Sleep Medicine Telemedicine program there. He has earned national awards of excellence in his field and leads education programs in geriatrics at UW Hospital and the Madison VA Hospital. Please welcome Dr. Stephen Barczi.
Thank you, Joe, and welcome everyone. I love to talk about sleep almost as much as I appreciate a good night's sleep. And today, what I'd like to do is move along here through what I would consider a tour de force, understanding a little bit about the role of sleep and the processes that involve sleep. What we know is as our scientific and clinical knowledge of sleep continues to grow, we now recognize that sleep is powerful medicine that can enhance our health, our quality of life, and even longevity. In this talk, I will review some of the mechanisms for how we sleep and why we need to sleep. I'll discuss the interrelationship between sleep and health, with a particular emphasis on why sleep might be changing as we age. I'll explore some evidence-based strategies and behaviors that we can all use to optimize our sleep for the sake of better health and our own well-being. With regards to, I'll say the punchline first, because I know that maybe a few of you might, through the course of this talk, just drift off a little bit. This is a perfect time for nap for at least people within the Midwest. And so what we know is that people who have certain healthy lifestyles or behaviors, and specifically quality sleep, exercise, avoidance of certain vices such as tobacco or excessive alcohol, in general, have a much lower likelihood of experiencing disability in their lives. And so I wanted to point out the sleep piece because, of course, it becomes very essential as we start thinking about what are the things we can do to sleep better and sleep longer. With respect to the overview of things, what I'd like to challenge all of you to do is think a little bit about, are you generally happy or satisfied with your sleep? Or maybe the sleep of a loved one or a bed partner. And during the course of this talk, I'd like to encourage all of you, maybe grab a piece of paper and pencil, and as I'm moving through the various topics, jot down at least one or two items that might ring true to you as far as possible barriers or factors that could be getting in the way of you getting an adequate sleep. To start with, it'd be valuable to recognize that there are a number of myths out there as to why or how we're not going to be able to sleep as well. But the reality is that the first big myth is that sleep inevitably becomes poor as we get older. And this is not the case. Granted, we all have changes in our sleep as we age. The second big myth I'd like to debunk would be the issue that sleep problems are chronic and rarely really treatable or resolvable. And the reality is that both of these things are not accurate, and that people of any age can sleep better by adopting certain healthy sleep habits and behaviors, and by paying attention to certain factors that could suggest an underlying sleep problem that, if addressed, could help with their overall health status. If we look for a moment at the circumstances of sleep complaints across the lifespan, We do acknowledge that as we move from our first and second decades of life into our fourth and fifth decades of life, there is a step-up increase in issues with problems falling asleep, problems with awakening during the night, or in other words, staying asleep, as well as not feeling quite as rested the next day, which might lead to daytime sleepiness. Unfortunately, in all age groups, women are more susceptible to these factors than men. When we think further about a surrogate for good sleep, which would be sleepiness, we know from national surveys that people who feel sleepy have a greater negative impact on their mood, on their initiative to be able to get out and be active, to exercise, and even in regards to getting important things done, work performance. So there's a direct correlation between the number of days that a person might be sleepy in a week and how each of these areas might be negatively affected. When we consider, as I was telling you earlier, about all the different organ systems that interrelate and all the different health factors that interrelate with our sleep, it becomes very important for us to acknowledge that a poor night's sleep has, based upon many different bodies of literature, been shown to contribute towards increased weight, problems with regulating blood sugars, challenges with being able to cope with or deal with pain, circumstances that relate to increased blood vessel complications with both heart and brain, and then, importantly, areas of cognition or memory, and in particular, sustaining one's attention. Lastly, and certainly important for any of us who might have a loved one or spouse who's around when we've not slept well the night before, it produces difficulties with us regulating our emotional responses. Next. So I'd like to proceed with discussing a little bit about what we know about the mechanism of sleep and why we need to sleep. The reality is that sleep itself is a biological or circadian rhythm that is linked to certain important clues or zeitgebers, if you will, that are specific to day and to night. And there are a number of external factors, whether it be sound, whether it be factors like light, that can further influence our ability to get to sleep. There are a number of learned behavior responses that we'll talk about a little bit later, as well as just any time we get emotionally aroused or possibly even upset in some regard, it can be more difficult for us to transition to sleep. But when we can transition to sleep, it becomes, it can link with certain very important biological processes or systems that become essential for life, really. When we consider some of these important roles that sleep serves, I can start with thinking a little bit about and talking about the relationship with hormonal processes. We know that growth itself in early life is linked to growth hormone, which happens to be associated with sleep. In particular, our brain, when we go into sleep, it is a time of brain maintenance, whereby a number of the byproducts that accumulate through the course of the day can be cleared, and our brain can be prepared for the next day's activities. We know that sleep plays an essential role with boosting our immune system or helping us to respond to immune factors that could pose threat to us. I've already mentioned the emotional factors that are involved, and that poor sleep can be associated with things such as depression. And lastly, and certainly importantly, the circumstances of learning. We know that sleep has, especially within the last decade or so, has been identified as a key factor for how we go about storing and consolidating our memories, and even being able to respond to problem solving in a creative way. When we talk for a moment about what are the factors that help us to sleep, or what the drivers might be, it becomes important to consider that the longer we stay up, the longer we're awake, the more prone we will be to want to go to sleep. And this just has to do with accumulation of certain neurochemicals in our brain, adenosine being one of them. And as we stay up longer and longer, this chemical builds up and we can become more and more tired. But our body has a wonderful way by which it can combat that increasing tiredness through the course of the day. And this is in the form of a circadian alerting mechanisms. So the longer we stay up and those chemicals build up, the more our body is able to, up to a point, keep us alert and awake. So these two factors, this process S that you see in this graphic here, and this process C, are kind of going counter purpose to keep us alert and functional during the day. But then if you notice the blue little mountain called circadian processes, sometime in the evening hours, that's when the circadian pattern of alertness starts to drop off. And when all those neurochemicals have accumulated and it gets dark outside, this is the perfect time for our brain to sleep. It'd be valuable to take a moment and just think about some of the important components of sleep. Most of you may be aware that there are different phases or stages of sleep that we go through. One might consider stages 1 and 2 sleep as shallow or light sleep. There is stage 3 sleep, which would also be considered deep, or some people call slow wave sleep. There is rapid eye movement sleep, which others might call dream sleep. And each one of these stages plays an important role for certain biologic processes I've described. And we tend to cycle between these stages through the course of an evening. As we age, though, there are some important changes that are going to occur with these different stages. We tend to have less amounts of deep sleep. We tend to have a little bit more interruption of sleep through the course of the evening. And this may then contribute towards some reduction in our total ability to sleep, or the variability in our time to sleep per night. Eventually, this can also even lead towards shifts in our sleep rhythm, with younger adults having more of a propensity to stay up later. And then through adult life, we have a fairly stable bedtime. And in later life, some individuals can feel the need to get to sleep much earlier. Another really important question that I frequently receive is how much sleep is enough? And I guess if we'd add a third myth to what I've been talking about earlier, this idea that as we get older, our need for sleep goes dramatically down. And this is actually not true at all. And as you can see in this graphic here that comes from the National Sleep Foundation, that the sleep need or the range of sleep doesn't change dramatically as we go from young adulthood to later life. In fact, maybe it drops off by about an hour or so at most. But we still tend to need anywhere from about 6 hours to 9 hours, even in later life. Probably a second way to think about this question is, how much sleep do you need to be able to feel restored enough to be able to function without struggling with excessive sleepiness during the day? And most of us probably know somewhat in our minds about how much that is. We've tested that because we've had weekends and we've had vacations. And so we know that if we sleep X hours, that we feel much better. Another important thing to consider is what are some of the circumstances that allow us to sleep? What are some of the factors, in fact, that allow for optimal sleep? And so we know that in the circumstances of an environment like a bedroom, that there should be a strong association between sleep in bed. Most of us sleep in a bed, although not everyone. And that bed becomes a place of respite, becomes maybe a place of tranquility, but at least a place kind of where we can escape. In the same vein, our brain needs to be throttled back. Think of all the events of the day and how charged up we can get. It's important that our brain and our mind be relaxed, calm in advance of sleep. This also means that, at least for some people, this idea of thinking about, maybe even obsessing about what's tonight's sleep going to be like, those can be very detrimental kinds of thoughts. Oh, am I going to sleep well tonight? Oh, I can't believe it. I may not sleep as well as I did. Oh, so it's good that we don't have too much of an obsessive perspective about what will happen with our sleep. With regards to other sleep conditions, absence of sleep-disrupting substances. And we'll talk a little bit more about this later, but we're all familiar with certain things that we can take in our bodies that may influence the ability to fall asleep or the ability to stay asleep. Generally speaking, a bedroom environment that's darker, that's slightly cooler, that's quiet, well ventilated, and recent national surveys even suggest with appropriate positive scents, not negative smells, can be a good place for us to sleep. We know that regular exercise has been, in many clinical studies and trials, been shown to be a positive factor for us to be able to sleep better, but not too close to bedtime. When we talk about another factor besides our ability to get to sleep and what factors might influence our ability to get to sleep, it's also important to address the issue of napping. So some of you right now would maybe have been napping if it wasn't for this particular presentation at this time. And I'm all for napping. The reality is napping is a good thing. And there's a number of reasons why napping is kind of natural. And yet, of course, our society doesn't necessarily endorse napping, and there, in very few work environments is there a place where people can break away and nap. But if we can nap, we know that things, for example, like memory can be enhanced or improved. And this particular graphic here is just an example of one of many studies that show that with various tasks that are involved with learning, including, these are all research paradigm tasks, that if one were to learn something, take a brief nap, and then look at the recall, it's improved compared to someone who learns something and then goes on to another task. When we think for a moment about our own sleep, and are we satisfied with our sleep, and should we worry about our sleep, there's some important or helpful, at least, screening questions that we can all consider. In general, are we satisfied with the quality of our sleep when we wake up the next day? Do we notice that sleepiness or tiredness gets in the way of us being able to accomplish what we want to accomplish? Or we might not recognize, but say a bed partner or significant other might recognize certain unusual behaviors, whether it be breathing or movements, that might not seem quite right. If any of these factors are a positive, or if any of these factors turn up as being a concern, then we may want to proceed with further assessment for our sleep. When we think about factors that can get in the way of a good night's sleep, it turns out that there are many different contributing elements. And so what I've done here is I've used a little graphic to kind of walk us through some of the common situations or common conditions that may get in the way of a good night's sleep. With respect to the items, what I'm going to do next is I'm just going to walk through each one of these points on the star and talk a little bit about each, and then start talking about some strategies one might take to combat each of these. So next. So poor sleep habits. All of us are guilty at some time or another of demonstrating at least a few of these behaviors. The reality is our lives are busy, society has made us even busier, and then we have devices that are connected to our hands and our hips that are reminding us day in and day out about connectivity. And so there are many reasons why we may not always demonstrate optimal sleep habits or behaviors. Certainly, those who have one sleep schedule during the week and a different sleep schedule during the weekends are stressing our body's internal clocks. We need to really maintain stable sleep schedule. And when we deviate significantly from that, it can be hard for our brain to track and hard for us to maintain consistent night after night good sleep. Time in bed. For any of us who've ever been ill or lying on the couch for extended periods of time, we know that while we spend more time inactive lying down, our overnight sleep may not be as good. Furthermore, I was already discussing with you those conducive environments for sleep, and we know that there are many reasons why we may not be able to have a conducive environment. Might be a bed partner who's snoring. It could be a dog or a cat that loves to jump in the bed. There are all kinds of variables, and some of these environmental factors we have control over, and some we don't. Napping, I said, was a really good thing, but everything in moderation. And the reality is that if we excessively nap during the day, that will take away from our total 24-hour sleep need. So I tell people nap, but nap properly. And that would suggest probably not sleeping more than an hour and avoiding those evening naps, which can be particularly disruptive to our ability to fall asleep. We know bright light exposure, we talked already about exercise, and we've talked a little bit about these substances, for which I'll come back to. I'd like to take a moment then and talk about behavioral approaches that can be helpful in addressing some of these maladaptive habits that we all acquire. And I'll start out by stating that of the audience here, some of you are heroic sleepers that can sleep under almost any situation. And unfortunately, some of us have more fragile sleep, and it doesn't take very much at all to wake us up. These are probably predisposing, maybe even genetic factors that we have. And then if you're watching this graphic here, those would be the predisposing factors. And then something happens in our life. Maybe a stressor occurs, there's an illness, something occurs that would be a precipitating factor that would at least temporarily drive us to poor sleep. Now, in some situations, our sleep will then revert back to better sleep, but not always. There can be things that we might not even anticipate that would be considered perpetuating factors. And many of the different psychotherapies or behavioral therapies that focus on better sleep address these perpetuating factors. Some of these maladaptive sleep habits, sometimes catastrophic thinking, like if I'm not going to sleep well tonight, I'm going to be doomed, or I'm never going to survive. Some of these kinds of thoughts. Or the association that can develop where the bed becomes more of a stressful environment. And every time we climb in bed, our stress hormones build up, and this does not allow for a good night's sleep. And in these situations, this can lead to more chronic insomnia. But as I mentioned, those behavioral approaches can be very effective to getting us back to better sleep. This is just a graphic, and I apologize not to try to lambast any of you with too much science, but what we know is there are different ways we can approach sleep. We can approach sleep difficulties with medications. We can approach sleep difficulties with those behavioral strategies that I was alluding to. This particular graphic, on the one column there, it says total sleep. The lower the number would be the better sleep. The higher number would be poor sleep. And in this particular, what we call randomized trial, there were individuals that got nothing. They were placebos, and you can see their sleep remained poor all along. Interestingly, those who received medication, and you can see that's the blue or the aquamarine line, they got a little bit better initially, but then they kind of stalled out, and their sleep was still not quite as good. For those who, and you see the pink bar below, received behavioral therapies, and in general, behavioral therapies might take just a slight bit longer to have benefit, but then you can see they had much more sustained benefit over time. And then sometimes we'll mix the combination of these behavioral strategies with medicines together, and that happens, interestingly, falls somewhere in between. So suffice it to say, if you're comparing a pill, which many of us get tempted to want to take, versus other behavioral approaches, which can be a little harder work, but in the long run, better for us, I would strongly endorse behavioral approaches. Next. With respect to factors such as the sleep hygiene that I was alluding to before, it really does become important that we try to maintain a regimented, somewhat stable routine in our lives. And it's not just bedtime and wake time. It turns out that we would call the life rhythm what happens throughout the day, when we're eating our meals, when we might take our medicines, when we go out, and then finally when we start to emotionally kind of wind down. Keeping with certain rhythms can help us to consistently sleep a bit better. I've already talked about the napping, and I mentioned already that there is probably a better time to nap, which would be the early afternoon. That also happens to be when we're most biologically prone to nap. That's right, the siesta around the world. Many countries have a very good idea there. Lastly, exercise. And what I didn't mention before was that there actually are probably times in the day when exercise is even better for purposes of sleep. So from the work that's been done, it appears that exercise in the afternoon and potentially into the very early evening is most conducive for better sleep. Exercise later in the evening or exercise earlier in the morning may not have quite the same impact. If we think of those other vices that I was alluding to before, now some of you may feel very strongly that something like caffeine or tobacco doesn't touch you. And if a person is sleeping well and they're drinking coffee up to the time of bedtime, more power to you. But for anyone who has a more fragile sleep or is not sleeping quite optimally, we have to be very careful about the influence of each of these different substances. I won't go into too much detail about tobacco. There's a lot that could be discussed about the challenges of someone who might be addicted to tobacco and then stopping smoking before going to bed and then experiencing a subtle degree of tobacco withdrawal through the course of the evening. The second question is, well, can I just cut back, or can I cut back on the last time I have a cigarette? And these all may be reasonable strategies. Caffeine, again, I mentioned that some people can be a little bit more resistant to the effects as far as the detrimental effects on sleep. But all of us have some response to caffeine. So once again, recognizing it, like other medicines or drugs, has a duration of action. And for most people, caffeine will wash out of the system with the stimulating effects in the brain washing out within about 4 hours. Lastly, certainly all of us have on occasion had maybe a drink of alcohol close to bedtime. And although we may fall asleep easily, what is very well recognized is that as the alcohol is metabolized in our body and dissipates, we tend to get more charged up or activated. So people who drink alcohol near bedtime may fall asleep easily, but they will often have fragmented sleep, awakening intermittently through the night. Coming back to the bedroom environment, we could talk for a long time, and this is where the science is a little bit weaker about just how much light, what type of bed, exactly what temperature. I mean, these items seem to be somewhat individually variable. Nevertheless, light in general, close to bedtime, is not a great thing, especially if someone does struggle with difficulties falling asleep. And I frequently get questions about, well, what about my tablet or my phone or my computer? And yes, we do know there probably is selectively a little more activating effects from blue light. Although, increasingly, I think some of the technology is adapting to that. Sound is certainly a factor, and some people can be very sensitive to sound. On the flip side, there are a number of people out there who appreciate a little bit of background white noise. And so in some respects, there's a little bit of experimenting that needs to go on. Most of us, not all of us, but most of us do better in a cooler environment. If anyone has ever been sleeping when the air conditioning is out in the middle of summer, you can attest to the fact that it may not be good sleep. Next. So thinking a little bit about the cognitive behavioral therapy, this goes beyond the scope of this talk, but suffice it to say, cognitive behavioral therapy is like a toolbox, and there's a number of different tools in that toolbox that can be used to help us to sleep better. I've listed some of the different behavioral interventions on this particular slide, although I'm not really going to walk through them in any great detail. What I will say, though, is that there are things you may be able to do considering pre-bedtime rituals that can be helpful. For anyone who tends to have a very active mind during the night, where it's just hard to turn things off, or maybe they fall asleep fine, but then when they wake up in the middle of the night, then they start thinking about the events of the past day or solving the problems of the next day. So what can one do in that circumstance? Some people will benefit from an hour or two before bed, sitting down and creating a to-do list, or what some would call a worry list, and even come up with one action or solution that one could consider doing the next day. So it's all down there on paper before you happen to go and climb into bed. It's also valuable to kind of quiet oneself. Figure out what it will take, whether it be music, whether it be a calm book, whether it be a dim light, to just disengage from the craziness of the day. There are other things that one can do. If you have pain before bedtime, make sure you're adequately medicating or doing whatever it needs to be done to manage that pain. Continually moving along, I'm going to jump through a couple of those other points, but fairly quickly. We know that there are a number of common chronic health problems or conditions that can be associated with reduced sleep. And so in this regard, by optimally addressing these various health conditions, we may be able to improve our sleep quality. And so in that on the graph below, you can see high blood pressure, diabetes, arthritis, heart disease, stroke, lung disease, and depression are all known to worsen sleep. Equally, there are many different medications that can be prescribed for some of those conditions. And a number of these medications can have their own effects on our ability to sleep. Whether it be agents that stimulate our brain, like decongestants or prednisone or theophylline, for example, or agents that might be excessively sedating during the day, therefore causing us to sleep and nap more during the day, or agents that just have direct effects on sleep, such as the common blood pressure medicine beta blockers, which can, in some individuals, produce problems with nightmares or problems with falling asleep. So this is just a very partial list. And I would encourage anyone who's on a list of more than a few medicines and they're not sleeping well to at least at some point maybe ask a local pharmacist or one of your health providers, is there anything on this list here that might be disrupting my sleep? We also can take things that we don't necessarily anticipate could have stimulating effects. So many different formulations of headache medications have in themselves caffeine built in. And so I just want to show you for a moment that a typical cup of coffee, now I guess it depends on where you go and all, might be somewhere around 85 milligrams of caffeine. Well, look at some of these different medicines for migraine or headaches that almost double the amount of caffeine. So be aware that some of these agents could be a hidden reason why we're not able to sleep well. I talked already a little bit about the brain being kind of entrained as a clock, and that central pacemaker in the brain then reaching out to many other parts of the body that all have circadian clocks too. We know that when the sun comes up, an important hormone called melatonin drops off. Throughout the course of the day, melatonin is almost minimal. That's what that little black line is there. And then when the sun gets ready to set, and these days it can be a little sooner than we want, then all of a sudden our melatonin levels will rise. And this, along with some of those other conducive circumstances, can prepare us for sleep. When we think about sleep patterns or sleep periods, this particular graphic here shows these bars represent a sleep period. So going to bed, say, at 1 and waking up at 9 a.m. If you're a teenager, many adults might go to bed somewhere around 10 or 11 o'clock and wake up somewhere around 7 or so. It can be seen, as I mentioned, that sometimes that internal clock drifts further. And as we get older, some older adults want to get to sleep much, much earlier. But what does this mean? It means that you will wake up earlier too. And sometimes that can be very maddening if you're waking up at 3 in the morning and you're the only person up. Next. Mood and brain changes. There's a lot to be said about the relationship between psychological or psychiatric conditions and sleep. This, again, is a whole talk in and of itself. But we do know are each of these conditions, whether it be depression, anxiety, post-traumatic stress, has certain characteristic features on how they influence sleep. Furthermore, dementia, which is an area that I focus a lot on in my field in geriatrics, produces some fairly distinct changes in the sleep-wake rhythm, where people tend to be waking up off and on more in the evening and sleeping off and on more during the day. And then Parkinson's disease also has its own constellation of features. Lastly, we talk about when I spend time in my geriatric sleep clinic. We focus a lot on some of these areas, and conditions like sleep apnea have gotten a lot of press lately. I want to point out from this particular graphic that you can see that many of these conditions, sleep apnea, periodic limb movements, a condition called REM, sleep behavior disorder, where we tend to move a lot during our sleep, they can increase in frequency as we get older. Next, I want to take a moment and talk about sleep apnea and restless legs, because these are two of the more common conditions that we see in sleep clinic. And so with sleep apnea, we may see people struggle with a lot of daytime tiredness or sleepiness. Sometimes they're not aware why they're so tired. They may have snoring, and not just snoring alone, but it could be fluctuating or undulating snoring, where it's louder and it's softer and louder. Sometimes people will wake up with gasping or a sense they're not getting enough air. Many times bed partners might notice some erratic pattern to sleep, to breathing that is, where they're breathing quiet or maybe even not hearing them breathe at all. We might call that an apnea. Waking up the next day, irrespective of whether it was 6 hours or 8 hours or 10 hours, still feeling exhausted or tired. Now, some things that people aren't aware are sleep apnea are commonly associated with increased nighttime urination and also with problems with cognition, specifically attention and memory. This particular cartoon here just shows that when a person lies down at night, some people are susceptible to having the muscles within their upper airway relax and the back of their tongue fall back and therefore block the airway. This is why, for at least some people, by changing body positions or by elevating the head of the bed, we can improve things like snoring and sometimes improve sleep apnea. We keep moving along. This particular graphic here shows, and this is something that I don't expect any of you to study in any great detail, but notice the 4 red arrows. So before those 4 red arrows, you see these little lines, up, down, up, down, up, down. That's airflow or breathing, and we want that. What we don't want are those flat lines. Those flat lines represent apneas. And you wouldn't know this, but to scale, each one of those is happening over 20 to 30 seconds. Now go down below those arrows and you see those little blue boxes. And that's oxygen level. So after every one of these little periods where we don't breathe for a while, you can see what happens to oxygen. Now, thankfully, our brain wakes up from these events, but you can see this would fragment our sleep. Next. And then what happens when a person lives with sleep apnea long enough is that we start to see complications such as high blood pressure, heart disease, increasing problems with heart failure and stroke. It can be harder to manage diabetes. And then it can lead towards areas of neurocognitive change whereby we may lose some of our vigilance and may be more prone for accidents, industrial accidents, or certainly problems with cognition like we were talking about. If we think about sleep apnea for a moment, not everyone in every situation needs to be treated. And this is a little controversial, but basically many of us would acknowledge that if a person is symptomatic from their sleep apnea, then let's treat. If a person has certain health conditions, even if they aren't having terrible sleepiness, but they've got cognitive problems or heart failure or difficulties with high blood pressure, then it probably is a good idea to treat. Lastly, remember those little blue boxes I showed you. If oxygen level gets low enough, That's not good for the heart, and that's not good for the brain. So in those situations, we would. Restless legs, the other process I was talking about. And this is an uncomfortable, jumpy, jittery feeling in one's legs that typically happens in the evening hours or before bedtime and can get in the way of us being able to fall asleep. It's actually pretty common. Next. And when we consider addressing restless legs, there are some things that all of us can do. Caffeine is known to exacerbate or worsen restless legs. Various medications can contribute to problems with having worsening restless legs. Some of the antidepressants, for example. When our brain doesn't have enough iron, this can lead towards some of the movement difficulties that are seen in restless legs. So we regularly check iron levels and screen for anemia when individuals have this problem. We know that exercise early in the day can be helpful too. When we think about memory, this is the final piece I kept on coming back to, and cognition, and memory. So what is going on when we learn something? So in the left lower box there, you see this person sitting in front of a screen. And next to that, you see something that almost looks like branches on a tree. Well, let's consider each of those branches as a nerve connection. And those nerve connections form as we learn new information. But then if you move over from the yellow side of the screen to the right side, when we go into sleep, we've got all these connections, some that might be important, some that certainly won't be important. And in the very first part of the night, our brain does some strengthening of the good connections, and then it gets rid of the connections that we really don't need. Like, what did we have for breakfast 400 days ago? And by the end of the night, most of that housekeeping is complete. So when we consider what is this relationship between sleep and memory, again, there's a lot that we can talk about in this area, but suffice it to say that certain forms of memory are reactivated or strengthened during sleep, whereas other forms are not activated at all. And this allows us to then prune out, so the big details, the big picture are there, but the little details dissipate. Additionally, we know that emotional memories can be reactivated during sleep. Anyone who's ever had a traumatic experience in their life can speak to this. But this can also be both a positive and negative for us. So in effect, there are many different ways by which our memory can be consolidated or improved as it relates to a good night's sleep. This graphic, I'm really going to just jump through in a moment. This brings up a whole exploding body of literature that's out there now that talks about the relationship between poor sleep and certain dementia conditions such as Alzheimer's. And all I'll say with this particular cartoon is that if we are sleep deprived, our brain does not have the same capacity to remove some of these various chemicals and byproducts that can build up in the brain and potentially damage our brain. So it appears that this is one of several potential important mechanisms that we might be able to focus on as we look at ways by which we can reduce the burden of dementia in our society. This being one of my last slides, gets into this whole circumstance. Okay, so it's wonderful to talk about activity and exercise and avoiding this type of vice, but does it really make a difference? And so this is one of a multitude of studies that shows that if you take someone and you create a more regimented schedule in their life, even more structure as to when they have their various social activities, exactly when they're eating, when they're having their physical activity and such, what do we see? Well, when we measure brain waves, we see there is improved slow wave or deep sleep. And remember what I was telling you moments ago about the value of deep sleep in consolidating our memories. And we know people can, not only do we see the improvement in slow wave sleep, but we see some improvement in various types of cognitive performance tasks. So we're wrapping up here. I told you this would be a tour de force, and it was really just a sampler of some of the important elements of sleep. But I challenge all of you, as you listen to my discussions today, to identify maybe a few things. Maybe it's a lifestyle factor, a habit, a behavior that we could tweak. Maybe it's a symptom that might be a hint of something more serious going on, or a medication that might be negatively impacting our sleep. So this is where we can adjust our lifestyles, or we can reach out to our health providers and have them work with us to improve our sleep behaviors, improve potentially underlying sleep diseases or diagnoses, and also optimize our medication regimen. So I'd like to, at this point, share this particular slide. This slide has two pieces of information. At the bottom are some books that my patients have endorsed. I have no relationship with any of these editors or whatnot, but these are some books that I have heard over the years have been helpful for my patients to understand deeper yet what's going on with their sleep. And at the top here, there are several URL web links. The National Sleep Foundation is a wonderful resource, and several of the graphics that were in this slide set come from them. And the University of Wisconsin has, amongst other things, a wonderful center, the Institute for Sleep and Consciousness, that has been doing sleep research, and the affiliate Wisconsin Sleep that's been doing sleep care for quite some time and is nationally recognized for the work it does. So with this, I would like to thank everyone and acknowledge that maybe a few of you nodded off a little bit for a brief nap because the timing was just right. And if so, don't feel guilty about it. But hopefully all of you were able to identify at least one or two little pearls or kernels for how you might be able to work on tweaking or optimizing your sleep, knowing that better sleep means better health. Thank you very much.
Thank you so much for that fantastic presentation, Dr. Barczi. As we said at the start, this is your chance to ask questions. Make sure to put those in the chat. We've got some great ones already. So let's get started. We've had some people ask, what foods or supplements, if any, aid or impair sleep? And I know you talked about caffeine and tobacco use. Can you talk specifically about melatonin and maybe a few others?
Sure. So I showed you a graphic that suggested that melatonin was spiking during the night and dropping off during the day. We know that some individuals with certain medical conditions or just by age alone can have a dampening of that melatonin spike during the night. And so there is a subset of people out there who will respond to melatonin and it can improve their sleep. The problem is we don't have a simple blood test to pick out yet who does and who doesn't benefit most from melatonin. When you look at big randomized trials, what you discover is that melatonin kind of washes out. Although when you look at certain subgroups, patients, they benefit very much. So what I usually suggest is if you really think that melatonin is going to be something you're going to try, in general, unless you go overboard, it's relatively safe and you can experiment and see. Now, as far as foods go, of course, there's the urban legend, or there's probably some science to it, the whole idea of L-tryptophan, which of course is an element within turkey. And so considering that this particular presentation was timed so well in conjunction with recent Thanksgiving, the L-tryptophan supplement at very high doses is maybe not a good thing. It's not available in many markets, specifically in the United States. If you want to have turkey more than twice a year, and for the sake of your sleep, go for it. But there really isn't, I wouldn't say, any absolutely conducive food that I would endorse. But I would avoid anything that would have stimulating effects on the brain.
Excellent. What would you say is the best way to adjust our sleep patterns when we shift to or from daylight savings time? I know you said that can have a big effect on sleep.
Oh, this is an issue that anyone in the field of sleep medicine shakes their head, because it's not great for our health, this idea that we're going to just randomly at certain times of the year turn our clock forward and back. There's more accidents, motor vehicle accidents and other things within the first 24 to 36 hours after this time change. Our body doesn't adapt as quickly as we want it to. Now, having said that, just like someone who might be traveling multiple time zones and be dealing with the whole issue of jet lag, theoretically, we could start to shift our timing of when we go to bed, and depending on if it's during the spring or if it's in the fall, so that it comes a little closer to what our next time zone will be, in effect, once we jump from 1 hour to the next. So if you think about it, people can transition over a period of 5 to 7 days with just slight gradual either movements forward or movements back in our bedtime to potentially address this issue.
Excellent. Can we talk a little bit about sleeping positions? So I know that you've got stomach sleepers, back sleepers, side sleepers. Is there a benefit to one or the other? If one is much more comfortable, would you recommend that, or just based on how well you sleep?
Certainly. And I do think that the comfort is an important factor. Assuming you don't have a certain primary sleep disorder, let's say like sleep apnea, where the position becomes important for the perspective of airway closure or airway opening. If that's not the case, and for example, if someone doesn't have a chronic shoulder pain or chronic hip pain that keeps them from sleeping on a particular side, then really it becomes very individual preference as far as what works best. As I had mentioned before, if there is snoring, then one can, well before a person is assessed for possible, sleep disorders such as sleep apnea, one can always manipulate the head of their bed. The height of their bed might improve some of that snoring. One other variable, body positioning and such. Nowadays, of course, we have all these wonderful beds that can raise our head up this far and then have our bed partner's head raised down that far, or raise our legs up this far. And again, if there's a medical reason why your body positioning might be better, if the legs are elevated or if the head is elevated, then I endorse whatever it takes so that a person can be comfortable.
Many people can fall asleep quite easily, but then they struggle with waking up in the middle of the night. And I know you touched on this just briefly, but are there any suggestions for why this happens and kind of how to overcome that?
Yeah, so if it's a subtle degree of awakening through the night and a person's able to get back to sleep pretty easily, then maybe major changes aren't necessary. But what I would say are the two groups of individuals where this can be really challenging are if a person has a tendency to wake up repeatedly through the night and then has great problems returning to sleep. So in effect, what's happening is the total amount of sleep over the night is going to be markedly reduced or truncated. And then a person is going to be more sleep deprived the next day. So what can we do when a person, say, awakens intermittently through the night? First thing I ask people to do is pay close attention to when they wake up from sleep, either at that moment or potentially the next morning, jot down what were the things that they were aware of that may or may not have been influencing. Did they feel like they needed to run off to the bathroom? Did they notice when they first woke up that their right shoulder was bothering them? Were they coughing? Is there a medical factor or a medical symptom that might be the precipitant for them waking up? Because potentially by addressing that medical symptom, one could sleep more continuously. Now, let's assume that those are not obvious. Then what happens if someone finds that every morning at 2:30 or 3 in the morning, they wake up and bing, they're wide awake and they lie there and they lie there. And let's say for the worst case scenario, they just can't get back to sleep. This raises the question, is it really a problem with insomnia, or could this be, as I was talking about earlier, a shift in that clock? Remember, we were talking about how at different age categories, people can have a shift in their clock. So let's imagine for a moment that you're someone who has had a dramatic shift much earlier bedtime, and you start feeling really tired at 7 o'clock at night. But who wants to go to bed at 7 o'clock at night? So we're going to do whatever it takes. We might watch TV, we might, even drink a little coffee or something, exercise, so that we don't fall asleep at 7. But let's say the clock started at 7 p.m. for our sleep time. And then we finally go to bed and it's 11. Well, we're 4 hours into what may be, let's just say, a 7-hour sleep period. So we go to bed 11, we feel tired, fall asleep right away. 3 o'clock rolls around, bing, we're wide awake. Because the circadian patterns in our brain have shifted, and we now may have the perspective that it's time to, at least our biological rhythms are telling us that. So in some scenarios, if this kind of pattern is recurring, I encourage people to talk with their provider or possibly even with a sleep specialist about whether it could be a circadian sleep disturbance. I won't really go into it now, but we can use bright light, we can use melatonin or melatonin-like drugs and other strategies to try to move those windows forward or backward if we really want to.
Interesting. We're getting a lot of questions about menopause and its effects on sleep. Could you touch on that, please?
Certainly. It is clearly a factor. We've known about this for 30 or 40 years. Anyone who's experiencing menopausal type symptoms can attest to the issues relating to heat and cold, relating to awakening sweating and such. And in many, but not all, many women, once they move through that menopausal transition, those symptoms will dampen. Sadly, though, there is a subset that could be as high as 25% or maybe even slightly higher than that persists with these menopausal types of symptoms affecting sleep long after they should be persisting. In those scenarios, then we start exploring, is there a role for managing those menopausal symptoms with medications? Now, of course, we're all very sensitive to the influence of estrogen and what negative effects estrogen can have. But in some scenarios, estrogen or estrogen-like products can have a very beneficial effect on sleep. And there are several other medicines that I won't really get into today that also can be used by physicians to try to attenuate some of those symptoms. The hope is that the symptoms will pass with the transition. Sometimes people will increase their intake of what are called phytoestrogens, which are a natural form of estrogen that can be occurring within the diet in products such as black cohosh and sweet potatoes, for example. But really, if it's an issue, I would encourage you to talk with your health provider to explore options.
Sounds good. So there's some questions about sleep schedules after retirement or during COVID where people had a very set schedule and now all of a sudden it's changed. What can people do for this?
Certainly. Many people live towards the moment that they can retire and not have to get up at X a.m. in the morning. Yet we know that sometimes some people can have very powerful circadian rhythms. And if they were someone who did shift work all their life and had to be up at 2 a.m. every morning, and now they're post-retirement, and they fantasize about the idea of sleeping until 7 o'clock or 8 o'clock. And yet, sadly, they find that they continue to wake up at this very odd hour that they no longer want to be waking up. And in this scenario, this is a challenging issue. And I will say that as a sleep specialist, there are no slam dunk easy solutions here. Sometimes people will gradually, instead of saying going from 2 o'clock to 7 o'clock all in one swoop, which may not go very well, they may gradually try to adapt their schedule in small increments, maybe 10-minute increments, and just slowly try to nudge that clock forward. Again, this is another one of those things where sometimes we will use other types of strategies that include what we call chronobiotics. Fancy word, but just means things that can shift that internal clock. Sometimes people will transiently use sleep-promoting medications or or properly timed melatonin. Maybe I will make one last comment about melatonin that I didn't make before, which is, please, if you're going to use melatonin, be very consistent about the timing of when you take it. Persons who take melatonin at 9 o'clock one night, 10 or 11 o'clock the next night, this can wreak havoc on that internal clock I was talking about. So if you are going to be taking melatonin or melatonin-like drugs, try to be consistent about the timing.
Excellent. Well, we have time for one more question. What are your thoughts about reading at night? Does this help or hinder sleep?
It's a good question. And it's kind of one of those questions where the answer is it depends. Because if a person is capable of disengaging from thought flow and finish reading a book, close the book, turn off the light, put their head on the pillow, boom, out, then great. But for a person with more fragile sleep, they find that they put the book down, but their mind keeps going. They put their head on the pillow and they lie there for a while, for longer. In those scenarios, the book and the engagement in the book, is it the light that we were using to read the book? See, these are all factors that could be considered. And in those cases, for a person who's not able to disengage and fall asleep right away, I would suggest one of two things. Either shift their reading to a little bit earlier and have a little bit more gap time in between, which is time where one might do nothing, or listen to music, or meditate, or pray, or do something that's going to help us to kind of throttle back. On the flip side, some people will choose to read very boring books before bedtime. And if they really can't, it doesn't engage them, then sometimes that can actually be a benefit for getting back to sleep. Is if you wake up in the middle of the night, get out of bed, climb into a chair with a dim light, read a boring book until you start feeling like you're nodding, and then climb back into bed. So that's why it depends. Whether you happen to be someone who is or isn't susceptible towards a very active mind.
Excellent. Well, that wraps up our question and answer portion for today. Thank you all for your great questions. On behalf of the Wisconsin Alumni Association in Capitol Lakes, I want to thank you all for attending. A special thank you to Dr. Stephen Barczi for your time and expertise. Before we go, I would like to remind you that the Wisconsin Alumni Association has an event coming up on December 17th, Poetry of the Moment, featuring UW professors Ahmad Jamal Johnson and Shireen Sherrard. You can register for this event and more at uwalumni.com. Thank you, and on Wisconsin.